Again, my name is Lynnae Ruttledge, and I would just like to share a couple of comments from today's session. And then I've been delegating so that people who are in the two sessions will actually give the report out. And what you see up on the screen is a sample of what you'll find on the app. This is from this morning's session. These were questions that were raised in regard to Mary McCarran's presentation. And then you'll see that people have voted with the like sign. And so we'll have a chance as the conference planning folks to look at what things seem to resonate most with people and what kinds of questions were asked. So I thought from the very beginning, one of the things that was really clear to me was that from the initial presentations when people were being welcomed, was that there's really a focus on interdisciplinary collaboration. And that's really true across all of the projects, and especially about what DOCTRID has done. I was particularly impressed with the focus on telling us about research projects, so that when people were giving their presentations, they would actually share, here were some of the things that have been accomplished, and here's the name of the fellow who was actually involved in that. The sessions this afternoon were so impactful because there were stories being told by DOC staff, and they were told from the perspective of people providing support to people with disabilities. And to me, that was really very much value added. Learning about life stories as an excellent tool, not just because it helps someone have voice, but it's a way that if there's a change in staff, people can quickly get up to speed on what's important in that person's life. And the ability to share that between the person and their family members, and then as someone experiences dementia, to say that back to themselves. And I thought that was particularly really powerful. I loved the whole question of, what do you love about your life? If there's any takeaway from today, that should be one of them, because it's a way of being able to connect with people and having them really tell you what's important, and to really use that as a way of getting to know one another and to understand what you value. One other comment was that if you have opportunities for small choices, that always leads to bigger choices. And so it's a real message to all of us that we have to have that expectation that you can give people small choices, and over time, those will grow larger and larger. The interactions were terrific. I had a chance to sit in on the session in this room this afternoon and also in room number 6. So I've asked representatives from both of those two groups to give the report out. And because of the time, what we're going to do, it's now 5:06. We want to be done at 5:45. So I'm going to ask people to keep your reports down to about 10 minutes. And Rebecca's going, oh my God, I only wanted to talk to her 2. I don't want to talk for 10. But keep it succinct to what you see as those key takeaways. And if it leads us in a direction of what kinds of future research opportunities do you see, that's the place we'd really like to focus. We had robust conversations in both of the sessions, and I think that you're going to end up hearing some really good things. So I'm going to ask Rebecca to go first, and that way she'll get it over with. Thank you.
Yeah. All right. So I'm going to report out on the workshop from session 2, and we already actually have ours listed in like our 7 most like important things that came from the workshop that had to do with future research direction. So we kind of already have that, and I probably will not take 10 minutes if even that.
Okay.
So one of the first things that we talked a lot about was exploring assistive technology and how we could explore that further in early intervention. And we especially had a discussion around the usefulness of apps, the different types of apps that are out there, and like kind of how we find those most helpful and how we could actually start to navigate more of those in early intervention and help parents figure out how to navigate those as well. Another issue another big theme that came up was bringing in issues and messages to parents earlier. So again, kind of going back to that early intervention sort of, school age, when we start to talk, before bringing in those messages and issues before they are actually a problem. So like preventatively talking about these kinds of things, such as sleep was definitely a big one. Sleep issues, wanting to talk about them before they become a problem, and then also how how that will impact further down the road. So wanting to stop those issues early. Toileting as well, and then also with sleep and toileting, how those can also help the kids themselves become more able to self-manage and to self-regulate in those areas, and how that will help them in other areas as well. Especially since sleep and toileting seem to be big issues for parents. So helping them navigate those areas will also help decrease stress in other areas of their lives. We talked about that along with food, helping kids learn how to, cook for themselves or manage their own food, kind of helping parents help them to do that so that it can relieve some stress for parents and help the kid as well. And then so those were kind of the main issues in terms of like those 3 things were the big things about wanting to bring in messages a lot earlier, like before they're a problem. So our 4th theme overall was talking about creating more of a landing platform for resources. So having one sort of area where all of these like apps and all this information resources for parents can go, so that they aren't just constantly searching for different things in different places, and also so that it's not like sometimes service providers, they bring something to a parent that a parent's never heard before, and sometimes a parent will bring something to a service provider that they've never heard of before. And so being able to have an area where everyone can access those, and the fact that some of that is out there, but still needing to get that out to parents on where they can find these kinds of things, and service providers as well. So then the 4th theme that we had was talking about using wearable technology to monitor health and physiological markers of stress, how that can help parents start to monitor those things for their kid, and also can help the kid themselves start to learn more independent skills and start to self-manage as well in that area. So then another theme was talking about parental stress, which actually is kind of a big overall theme in all of these little things, but talking more specifically about parental stress and service availability. So like being put on a wait list and how that impacts parental stress, as well as how other factors that might be outside of their control, such as like housing issues or things like that, might impact stress, and how we help the parents deal with those things. And more, kind of how service providers can help talk about those kinds of things a little differently. So that's that on that one. Then the 6th theme was to talk, in terms of research, one of the things we might want to look into is asking parents who have successfully kind of gone through some of these issues before, such as, toileting or things like that, or even just parents who have adults who feel like they've been successful, they kind of have been there, they've done it, asking them what they've gone through, what was helpful, what did they find most helpful, how did they navigate some of those things, and then also like what did they wish that they had, so that we could start to look at what are some of the things we could explore further, create further, especially if we have specific ideas, like, a certain kind of app or a certain kind of intervention, and saying to a parent, would you have wanted this, would it have been helpful? And, if so, why or why not? Those kinds of things. So really asking parents who have already gone through it, what's going on for them, or what happened for them. And then the 7th and final theme was that we need to engage the individuals with disability themselves more so in research. So actually asking the kids, asking the adolescents, asking them, what's going on for them, find different and unique ways to engage them using different, methodologies, different tools to get at their experiences and what's happening, as well as policymakers and funders, which is always hard, but that's still, a goal, something that we need to we need to work on engaging those people more as well. So I believe that was it, unless there was anything else. All right.
Thank you. So it sounds like that was a really robust session. I'd be interested to know from the folks in the audience, if you were in that session, is there one thing that just kind of rises to the top for you of what you think a future direction might be? You're all comatose from eating cookies on your break. I can tell this. So did it resonate with you about the active engagement of people with disabilities in research? Was it more compelling to you to hear about how do you deal with real just basic stuff like sleep, toileting, the issues that literally keep parents up at night, and they really don't know how they're going to be able to make all of this work, and looking at some potential ways of sharing what we've learned so far. But anything that kind of raises to the top? So I guess nobody was in that session. Oh, there is someone up in the very top. Yes, thank you.
To the group I was with, yes, it's me again. I think it's very important, speaking regarding the area of autism, is actually getting their input on areas that need to be researched. If there's things that they see that others are doing, or that the aspirations that they have and they need help getting there, if there's somebody that they admire but they're looking going, well, how could I ever get there? In order for them to actually to let you know what they need you to research. And I think it would be the exact same with the area of for those intellectual disabilities. I think Fionn would be great to give suggestions.
Yep.
And you know, had a great chat with them earlier on, and I really think that there's so much feedback that the researchers can get before you even put the first pen to the paper.
Right, exactly. That is a very powerful dynamic. And once you've started to engage with people, what you'll find is that their insights are incredibly targeted about what they know they need and what they've observed does or doesn't happen in either their home life, in the community, in the services. So I think learning from that and engaging with them early on will make for more relevant research as we move forward. And I particularly appreciate that people who are parents who come forward and say, here's the experiences that we've had, and here is ways that we really would like the system to work better for us, are a really powerful voice. So, okay. So you're off the hook. We'll move on to the next session. So the aging folks didn't have to move out of the room. They were here. But I think most people have already left. So it's okay. So who's going to do the presentation?
I think I'll start.
Okay.
Is it okay that I just stand here rather than trying to navigate my way down to the podium? Can you all hear me okay?
Yeah. Does that work?
Okay. And I'll try to speak up as loud as I can. So the first thing that we focused on, we had 3 really wonderful presenters. And
I think we're going to have to give you a mic so that we
sure.
actually get it captured on the video. Yeah.
Great, and then I can really be projected.
That's right, exactly. Yeah.
Okay. Oh, that's nice.
Oh, look at that.
Yeah. Okay, can you guys hear me okay?
And please introduce yourself.
Thank you. My name is Alicia Strain, and I'm a doctoral student at Michigan State University. And so
I need to interrupt you.
Can I make a suggestion? Since we have video recording,
yeah,
so
okay.
for audience who cannot.
Yeah, sure. I'm sorry, can I, do you mind if I should have done a better job preparing. I apologize. Thank you.
And just know that we're going to use the same process tomorrow afternoon, so be prepared to get drafted. Yes. Thank you.
Yes, of course. Okay, so I took some notes. So forgive me if I stare at my computer a few times. I want to make sure that we capture the key things that we talked about today. So what I want to just talk about real briefly before I hand it over to Michael, and Michael's going to sort of summarize for us. But we had some three key speakers that were representatives from the service providers in our community. Or sorry, I say in our community, but in the community here in Ireland. And so what I want to do is I want to highlight the three key speakers and what their purpose was and some of the things that they highlighted in each of their presentations. And I like to look at what they highlighted as best practices. And I think that they did a really wonderful job identifying what those best practices are at both the individual level, at the service provider perspective, and then at the system level. So our first speaker focused primarily on best practices at the individual level. I'm sorry, I'm out of breath. Okay, let me take a deep breath here. Okay. So our first speaker, the best practices at the individual level was really identifying the importance of making environmental adjustments and accommodations in order for individuals to maintain access to their community and life enjoyment. So they can engage in those life enjoyments. And really it was about bringing services to individuals, not expecting individuals to participate in services going outside of their homes. So how can we bring services into homes to provide supports for individuals? We really also talked about the importance of multidisciplinary teams and the value of having multidisciplinary teams. We also talked about the importance of continuity of familiar staff. So making sure it's the same staff that's providing services for individuals over a long period of time and really trying to reduce the turnover in staff. We talked about the importance of social supports, including friendships and family, and making sure that friendships are maintained and families are included in decision-making processes. And something that I really enjoyed was focusing on having a day of pampering and how can we normalize that, especially for individuals that are aging with dementia and ID. So that was the first speaker, really focusing on individual services. The second speaker was focused more on service providers and best practices for service providers. And so some of those best practices are recognizing signs of when an individual is going through an acute dying phase. What are those signs and what kind of supports and services can we provide to help with that transition? We also talked about supports to die well and respectfully. So talking about the importance of having a good environment, sustaining those relationships, friendships with friendships and community members and family members, making sure that they're comfortable and have a peaceful environment, and making sure that there's professional expertise on the multidisciplinary teams. And also, it's also important to engage in activities that are fulfilling and provide enjoyment. And we also talked about the importance of symptom management and especially palliative symptom management. And the idea of including spirituality and respecting individuals' focus on spirituality and the importance for individuals that's really supporting their individual spiritual beliefs. And then something that I think Michael's going to touch a little bit more on a little bit later is the importance of staff being supported throughout these transitions. So not only are individuals going through these transitions, but staff are going through transitions too, especially when they have multiple individuals going through that acute dying phase at the same time. Okay, so that was speaker 2. Speaker 3 talked more about the environment as therapeutic care, so more at that the system level, and how can we provide more person-centered care, the importance of individual preference needs assessments, and making sure that those are included all throughout the process, and understanding, appreciating, and including different perspectives. So perspectives from all individuals on the multidisciplinary team, family members, and absolutely the person with ID and dementia. And the last two things that were included in that speaker's presentation was post-diagnostic supports, including that revolve around cultural supports, physical supports, social supports, and solitary activities. And the last thing was advanced care planning that begins as early as possible. So I think it was a really nice array. All three speakers really touched on individual supports or perspectives from an individual perspective, and then service provider perspective, and more of the system perspective. Okay, so now I'm going to hand it over to Michael, and he's going to expand on that a little bit more.
Okay. So I always appreciate when you are summing up what a number of people had said at a session like this. You're really only skimming over the surface, and I think what was great about people's contribution is that it came from, you could feel years of experience behind what a lot of people's contributions were. So my apologies if this appears a little superficial. It's certainly backed up by a cumulative hundreds and hundreds of years of people's lived experience. Very quickly I typed up what our key topics were from this, and as you can see, we had maintaining identities using life stories being critical to maintaining the person, but also supporting a continuum of care. And it speaks to your point as well, that the Life Stories project, while it works very well for the individual to be able to hold their memories, it also acts as a really useful way to introduce the person to new staff and to understand what this person used to be able to communicate about themselves may not be able to anymore, but still likes. There is a need to look at the different costs of care in the different settings, because in each of the three speakers was speaking about a different setting for people with intellectual disabilities and dementia, and that there is a real need to try to understand the array of costs involved in those different settings. How much does it cost to have somebody in a custom-built environment like Willowview or Meadowview, in comparison to keeping them in their own home where they're currently living and making adaptations there. But that means nothing unless you're doing it in the context of quality of life as well. So it's important to look at those two factors together. There is, sorry now. Well, a lot. There's a need to understand transitions, and transitions was something that we spoke about a lot, and it came up over and over again. And again, in this particular context, it was about, let's say, somebody transitioning from one environment, let's say a community group home where they were living, into another location that provided more specialised care. And one of the presenters, Catherine, made the point that she felt really honoured to be able to stay with this woman that she had over many, many years been providing care to, that she felt honoured and privileged to be able to maintain that through this woman's dementia journey into what is now very late stage dementia. And that we do need to appreciate that staff also have connections to the people with whom they work with every day, and that we want to try to make sure that staff are supported, and that also families understand and work out ways in which they can adapt to transition. It's one thing to ask a family at the start of a transition process, well, what do you want? But what a family might express that they want at the start of a transition process might be very different about what they might want halfway through when they realise the realities of what's happening during the transition. And recognising as well that there's also a need for training and for support for staff dealing with transition, as well as support for people with ID themselves and for families and loved ones. How do we properly resource the holistic approach to dementia? And that is really looking at the cost of all of the things that, not just the basics, but also all of the ancillary, what some people might consider ancillary, but what we would consider to be all part of providing a really full approach to dementia. A better understanding of of relationship-based care, especially for staff, and viewing this as a major life event. Niamh earlier on during the day was talking about major life events. That that the dementia journey has an awful lot of ups and downs in it, and it is about being able to support everybody within that, and specifically supporting staff in the bereavement of transition. And we later on we're talking about disenfranchised grief, and this is something that staff in the ageing sector as well as staff in the ID sector appreciate and understand, that because you're staff and you're being paid, it's almost like you're not grieving for this person who you've built up this relationship with over years and years. You are grieving for that person, and simply because you are a paid staff member, it doesn't mean that you are not connected to that person. Supporting people still living at home with families. The scenarios that we were talking about were not including people who are day service users who go home to family. And that one of the big questions that we were asking is, well, what would that kind of support look like? How do we build that support? For people who wish to remain at home with family, how can we support them to stay at home with family for as long as possible? Then we were also looking at asking families about their experiences and views post-death, because their perspective and their how they appreciate the experience of the death of somebody with ID. If we can gather those kinds of perspectives post-death, we might then be able to feed that into better dying and better death for people within the services. There was a very strong point made about clear and transparent communication around dementia with somebody with ID and their families. So finding clear and appropriate ways to talk about dementia and what it means and what a diagnosis might mean and what to expect is very important. Support at the dying stage and a better understanding of the acute dying stage, and also what happens when things go wrong at the last minute and the staff anxiety about that. So we had a story about somebody where the whole staff and everybody was prepared for somebody to die at home, and that they had buy-in from the GP and they had buy-in from palliative care staff and so on. And then at the last minute, when somebody went into the acute dying phase, the GP wasn't available to come out. So staff got very anxious about that. Thankfully, in this case, it had a good ending in that the person did get to die at home, in their home. But how do you make sure that you have a fallback plan within that? And what would a fallback plan look like? And how do you ease staff anxiety about what is a very stressful situation of somebody coming into the last stages of dying? Disenfranchised grief I referred to earlier. And then there was also a question then about a better understanding of the ageing of people with autism spectrum disorder. So how do they age? And that is something that in IDS Tilda, there isn't an ASD cohort within that, although in the current wave, we will be able to identify if people have a diagnosis of ASD. But certainly there's a dearth of knowledge in this area about how people age with ASD, although somebody in the audience did make reference to the fact that there is some data in the States, but certainly from an Irish perspective, we don't know, and that there are a lot of people who don't who don't have a diagnosis over a certain age. And this, to some extent, is mitigated by the individualised care that people get in that the care is shaped around the individual and their wants and needs. So that to some extent mitigates the fact that they don't have a specific explicit diagnosis of ASD, but at the same time, future generations coming up will have an explicit diagnosis. And what does that mean in terms of their ageing, and how will they experience ageing, and how can we better understand and therefore put better plans in place? And I think that covers all of the main things that we captured in that.
So I'll raise the same question again. As you listened to both of the presenters and you heard more about what happened in that workshop session, are there things that resonate with you? Are there key takeaways that you believe kind of rise to the top as you think about what are future directions for our research efforts? No key thoughts. When I was listening, I was hearing the significant role that I think we need to really pay attention to of the person who is the staff person, who is giving the care, who's actively engaged, and how do we make sure that they stay healthy? What's the impact for the very intense services that they're providing? And what could we do better to be able to support them, better to learn from them, better to learn from the person with a disability that has been provided those supports? What can we learn about how to help those staff do a better job in that transition? And I think that might be a way to be able to start thinking about forward-focused research. Other things. I had heard comments in Geraldine's session about wanting to make sure that when we're engaging with families, engaging with people with disabilities, about finding out, are there things that we can learn between the two systems of what happens in the United States, what happens here in Ireland and in the EU, around things like credentials. So we have a very high standard in Ireland about what we expect from someone who's considered to be the expert in assistive technology. And is that the same standard that's used in other systems? And if it is, terrific. If it's not, what could we learn from that? And I think we have a really significant asset in having the numbers of people involved from Michigan State University, from our colleagues across the United States and in Canada, but also then the colleagues that have been involved here in Ireland and in the EU, and to say, what are some things that we want to know about the way things are done that might help us as we move forward? Are there some standards that we would recommend? Are there some ways that we would start to try to capture that? And is there a place, like a platform, to have that information? So it doesn't have to be full-blown research, but it can be a place to be able to get that kind of information.